Live chat. Remember to guard your privacy and anonymous. Okay, yes. All right. Okay, let's start. Okay. Wow. Hey, this is Toki from Medical. Just introduction and showing the product. So, our company, we make reduction technique task trainer, such as finger dislocation happen, and usually, you assume those doctors they practice how to put it back. These no, it's okay. So how you gonna do it? Now I come this product. So you're gonna push and pull. If you do that, snaps. Again, it's dislocated. Push and pull. Go back in. Okay. So next one is the elbow model. Elbow dislocated. Okay, this happened. Now these days the jiu-jitsu is very popular. People didn't know when to stop and dislocate. Then you have to fix it, right? Well, you go to the emergency room and then you assume those doctors, they know how to put it back, which they might learn about it, but we never had a hands-on practice. Okay, so this is a task trainer. Okay, this is the patient facing down the table. Okay, little extension with pull down. You really have to pull. If you do that, go back in. Okay, again, little extension and pull down. Any questions? Well, the product, the tension is adjustable. I get a comment all the time. Actual one is not that easy. Well, it's easier when it's, you can reduce right away on site. So, but, if you go to an emergency room, it'll be different story. Okay, it's gonna be after what, 4 hours? Dislocated. Pull down. Now it's in. Okay. Finger one more time. Its finger is dislocated. Okay. A couple of different ways. One way is you put your, so this is the middle finger is dislocated. Okay. This joint. Okay. Get on top of it like that. Okay. So I use my index finger under. Okay, I use these 3 to wrap around the fingers, the tip, okay? And then put my thumb on top and then push, pull, snaps. Again, put my index underneath and then use the other 3 to wrap around the tip and then pull. If you see it, snaps. Another will be push and pull, little extension. If you do that, snaps. Okay. Again, elbow dislocated posterior, like you falling, you're trying to catch yourself, and then this happened. Or jiu-jitsu, people they don't know when to stop, and then dislocation happen. Okay. Think about this is a table. Patients on exam table with bleach or something facing down. Just the edge of the table. Okay. Little extension with pull down. Okay. this is one of the biggest dislocation would be hip dislocation. Okay. So hip dislocation would be like a car accident. Okay, you're sitting down or driving and the knee hit the dashboard and body goes forward, right? I'm gonna hurt a lot after though. I mean, yeah, that's painful, but I mean, you need to reduce. All right, so it's hip dislocated. Okay, posterior means backside. Okay, so this is a technique called Captain Morgan technique. If you're old enough, if you drink, you know the rum, Captain Morgan rum. You know, he put his legs up to 90 degrees on the barrel. Some, I guess, drunk healthcare provider decided to name this technique as Captain Morgan because you're gonna bring the patient's knee to 90 degrees, okay? And then you put your knee underneath. And then what's gonna happen is you push your toes down. It's a physics. Hold on. So it's hard one, but you know, it's interesting technique called Captain Morgan technique. Tune in, pick up at 5 p.m. for Joneses. I don't care. All right, one more time. Finger dislocation, right? Push and pull, goes back in. Just look at her shoulder, then she put it back in place. She said it hurts a lot. Yeah. Shoulder, please. Yes, shoulder is coming. Okay, it's a shoulder model. Okay, so let me get a closer. All right. It's dislocated anterior means to the front. That's the usual. Over 90% that happen to the anterior. Okay, there are many different techniques. Which is better, best? My honest answer depends. I don't know, because if you're strong, any technique is easy. You know what I mean? So one of these technique is counter traction. Okay, so what I would do is just use my hand to counter traction. Push that way, hold the wrist with the other hand. So this one, I'm gonna pull. So push and pull, and also turn the doorknob all at the same time. If you do that, go back into socket. And you really have to use force. Useful information here. This is great. Thank you for the comment. That means a lot. I could do so many fun things with this device. What does that mean? Please read my comment up top, brother. What does that mean? I don't get it. What are you pushing on? Oh, this is the shoulder model. This is a task trainer, okay? So when you, let's say you have a dislocated shoulder or elbow, usually called EMS, or you go to the emergency room and you assume those doctors, they practice how to reduce this dislocated joint, like finger, right? And you assume those doctors, they practice like a suture or anything, they practice those skills. There's no way to practice, okay? They're waiting for you to come to the emergency room, so they can practice on you how to do this, and then you have to pay for it. So that's what it is. Mine is task trainer to practice reduction techniques. What is that? Me neither. Very informative. Thank you much. Mind. Double. How to ask, you already know the answer. If you have to ask, you already know the answer. Okay. Okay. I broke my collarbone, 2 bones at the top of my shoulder and tore ligament of my scapula. Ooh, that's a bad deal. All right. No problem. I'm gonna start over. So, finger dislocated, okay, and couple different techniques. One of the technique I use is so middle finger is the most common finger to dislocate, and this is PIP joint that they call. You don't need to remember, but this is the most common finger. Okay, like I'm playing basketball, ball hit the tip, and this one get on top of it like that. Okay, so in that case, I use my index finger, put it underneath, and then these 3, okay, wrap around the tip, okay, and put my thumb on top. I don't know if you see it, this way, and then pull, snaps back. So how come? Hold up. So how come the doctor don't use those to practice when they have downtime? Well, good question. They don't, okay? My product is new too, so maybe they don't know. So if you can share, they might know. So I appreciate it if you can share them. Do you know the stream will be much better? I have no idea. Thank you, welcome. Chinese man goes to an eye doctor. Doc say hip and not contact. I don't know. I don't get it. What do you get? Okay. Elbow. Dislocate. What is your product? So this is a task trainer to practice reduction technique, relocation technique. Think about like a CPR mannequin. You compress the chest, then they will make a sound. It's a feedback to tell you you're doing right. Well, there's no device to practice reduction technique. Okay, fingers dislocated. Okay, you have to push and pull and feel that snap. There's no such a thing. Well, this is the product now I'm trying to promote and sell, and but every actual reduction is the practice. Okay, elbow dislocated. Okay, let's do this with. So this is one of the technique. Okay, so this is the table, patient facing down, exam table, and the little extension is pull down. You have to pull, really, not pretend. You have to pull. If you do it, go back in. Okay, so seriously, these are the product the doctors they need to have to practice when they're downtime, like you said, and hopefully they recognize my product and they use it, they buy it, and then it's beneficial for everybody. Okay, one of the if you know the drama called Pit, ER drama, and first series, episode 6, in the first series, there's a hip dislocation patient came in, and they had to fix it. Okay, how they teach resident is exactly the way it is right now. You got to pick one resident, and then you teach them how to do it. But the only one resident get to practice. Okay, so this technique called Captain Morgan technique. If you drink the rum, Captain Morgan, he put his legs up 90 degrees. Think about it. This is, so you bring your patient's knee to 90, okay? And then you put your knee underneath, okay? And then push your toes down, use the physics. If you do that, ooh, it's hard. Ooh. Sorry. Oh, what happened? Well, it doesn't work now. Hold on. Huh. Hold on. Oh, yeah. Sorry. It didn't fly. That's the technique, and that's how you practice. Okay. But usually they practice on live patient, okay? So that's amazing. My daughter is going to college next year for pre-med, yeah. Well, this is the thing. There's no way to practice, get better, and also there's no way to test. It won't be on the standard. That's one of the things. And since it's too new, still it's, people, they don't know about my product, and hopefully people recognize, there's no way to practice, right? You have to wait for live patient, which it takes for a long time. You don't know when it's gonna happen. But with my model, you can practice as many as you want. So, yeah. All right, you get. What are you talking about? Did you get the corner? I'm not sure. Any questions, any techniques? If it's not the stream, I would have to get in this, not the good. Why you guys make a comment about? Okay. Seems like a great solution. Good luck to you. Thank you. Thank you for the comment. That means a lot. It took for a while for me to get here, but so I have the finger dislocation model, elbow, shoulder, and then the hip. And then I'm coming up with TMJ, jaw dislocation model next, and also the ankle model after that. So, if you're interested, please check my channel. And then I get it. That's why do you do that with the money? You have the money to. I don't get it. Okay. Any questions? Any technique you want to see? Technique-wise on the elbow, there's another one would be you can do on the ground, right here. Okay. Use your body, straight your arm, and then a little extension, and then pull up. Go back in. Except the hip model, my model, the tension is adjustable. So, you might think, oh, it's not that easy. Well, Yeah, you can make it harder on this model because the tension is adjustable. Okay, again, like that. Okay, that's pretty much it. Any questions? Something you want to see? Okay, anterior joint have a tendency of will for being able to get one from my car or something like that. I don't understand your question, Baba. Okay, I think that's pretty much it. So, thank you.